Welcome back to Your Health. I'm your host, Dr. Bruce Banal. My next guests have been making headlines for a really interesting medical procedure. Last year, Melissa Gomez was in a car accident that left her arm paralyzed. This May, Dr. Andrew Elkwood of the Plastic Surgery Center in Shrewsbury performed a living donor nerve transplant to reverse the paralysis. They join me now to tell us about this amazing procedure. Welcome to Your Health.
Welcome.
I guess, Melissa, congratulations.
Thank you.
Let's start off with, you're in a car accident, and what happened to your arm in the car accident?
It was left basically paralyzed. I use the term as saying that it was a dead arm, useless. I couldn't do anything with it.
And that was because you cut the nerve or any muscles, tendon damage done?
It was separated from the spinal cord. The nerve was.
So, Andy, that's a pretty radical thing, is to just be separated from the spinal cord.
Right. That's an area of the body we call the brachial plexus, where the nerves come from the spinal cord and mix and match and go into the arm. And she tore about 3/5. There are 5 nerves that come through the spinal cord. She tore away 3 of them.
And that's really an unusual problem, I would imagine, without having a whole transection or an amputation.
It's probably more common than it is recognized. And often these patients have a whole host of other injuries and things get overlooked. A lot of the medical community doesn't even know that some of these things can be repaired. So we don't always see all of the injuries, but they're out there.
And that's probably, we're talking about the nerve, whereas most people think about accidents and transections or lacerations of the whole muscle tendon.
Right.
And they don't think that the nerves, and they really don't remember that the nerves control it all.
Exactly. And these can be blunt injuries, and they most frequently are blunt injuries, meaning that it's a tear and the skin is never opened. So you don't see the injury per se. And if a person has a broken arm and other things, you don't wonder why they're not moving their arm. You presume it's from the fracture or what have you.
Now, Melissa had this accident in December, and you did the procedure in May, so that's 6 months after. Is that the normal time this would be done, or?
Well, there is no normal time for transplantation. It's such a rare procedure that normal hasn't been developed yet. But as far as fixing these areas without transplant, the old teaching is that you always like to get them before a year. But the truth is we like to get them much earlier. The sooner you get them, the better the patient does. We usually allow about a 3-month waiting period to make sure the patient doesn't get better on their own. And if they don't, we'll operate. We'd like to catch it 3-6 months in that area.
And Melissa, it must have been very frustrating for you having this arm, and it was essentially paralyzed?
I kind of got used to it, like not a lot. Like I could move it ever so slightly. And I just got used to it. And then going through the surgery and getting my arm back now, it's like unbelievable. It's remarkable. I'm so grateful.
And any problems with your arm? Is it using it completely normal?
Almost 100%. It's not like, it was before the accident, but it is like a lot better. I can do a lot more. I can drive. I can open a bottle. I can hold stuff in my hands. I can do my hair. I can put my own clothes on. I can take my own shower now. It's so much better now.